What's up, guys? It's Dr. Jim. I am your pregnancy chiropractor and your natural health care expert, and I want to welcome you to this video where we talk about pregnancy and chiropractic. And last week's video was about the microbiome and some things you may want to do. And then this week's video, I'm gonna talk about why chiropractic when you're pregnant. Well, people want to know. I see a lot of pregnant patients, and so people really want to know, especially pregnant women, want to know, why would you see a chiropractor when you're pregnant? Well, there's a number of reasons, and I'm going to try to hit them the best that I can. Now, the first thing that I tell everybody is that if you're pregnant now, or if you're planning on being pregnant in the near future, or maybe you've had a child or two already, one of the things that I want you to know, and I know you will take this the right way, you were 100% built for this, okay? You were built to be able to be pregnant, okay? You were built to deliver a baby, all right? So one of the things that I tell everybody is you don't really need any help having a baby. We just need no interference to how the body should naturally work. And that's really what I do. When it comes to, think about it this way, there's a lot of changes that happen when you get pregnant, okay? Your belly starts getting big and it moves way out in front of you, and that puts a lot of unique and unusual stressors on your hips, your pelvis, your lower back. And, those stressors mixed with the fact that we have an increase in this really great hormone called relaxin, which starts to make your ligaments get a little looser. Once you put those two things together, it can do one of two things. One is it can exacerbate a problem that you've already had, or, just all that stress and pressure can cause a shift in your pelvis. Now, usually what we'll see is a misalignment in one of your SI joints. Now, SI joint stands for your sacroiliac joints. You have the two dimples right at your lower back. Those two dimples they're not just there to look cute. They are the main joints between your hips on the side and the sacrum at the bottom, your pelvis. Those are your SI joints, and they're the main weight-bearing joints of your spine. But they're also the joints that are going to need to shift when the baby drops down into the pelvis, so they start to become a little, more unstable the more pregnant you are, and they'll often shift out of alignment. Now, when they shift out of alignment, what we'll usually find is they shift out of alignment on one side, and then across the pelvis in the front, we'll see an increase in tension in like the inguinal ligament or the round ligament or even the abdominal muscles. Now, that misalignment mixed with the tension in the, in the ligaments or the muscles create a cross-pelvic tension. And these can become an interference. Now, that interference, not only could that be causing you discomfort or pain while you're pregnant, but it becomes an interference to where babies go and how they can get there and when they can get there and if it's easy to get there or not. And so my job, okay, and I tell everybody this, I don't physically move babies around or do anything like that. My job when you come into my office is to find these interferences and in a very nice and gentle, easy way, remove that interference. Because when we remove that interference, not only do you get some relief, like, whew, my back feels better, my hips feel less tight, I have less pain, but what it also does is it allows babies to go where babies want to go, where they're supposed to go, and when they're supposed to go, and as easy as they're supposed to get there, okay? And so that's a huge part of it. So chiropractic during pregnancy has some really great benefits. They tend to lead, if you get chiropractic during pregnancy, it does tend to lead to lower interventional births. I think most people would like less interventions during their birth process. There's less breech babies, there's less posterior babies, and mommies have less pain, and it reduces labor time. You heard me, it reduces labor time. It's the number one reason that, that my patients come in and like, well, that's what I want. I don't want it to take too long. I want that. And so to give you an example, an average first-time labor is usually approximately 14 hours. An average first-time chiropractic labor is 9 hours. All right? How does that sound? That sounds awesome. So there's a number of reasons why we get chiropractic when you're pregnant. But it's really, we can help relieve pain for mom, but we also remove interferences so babies get where they're supposed to go, how they're supposed to get there. And when we do that, there's less interventions, there's less breach, there's less posterior babies, and it helps improve labor time, which I think is what everybody wants, right? So I'm just excited to share this video with you. Please like it, share it, send it out to all your pregnant friends, send it across the country. We want this kind of great information to go viral. Just like I tell my son every day before he goes to school, be your very best today. Hashtag never quit. And the day, well, I believe that God wants the very, very best for you. And the day you believe that, it's going to change your life forever. Have an awesome, awesome day.